We're really proud and excited for Canadians to be able to apply for the dental benefits starting tomorrow, and also for federally regulated workers, the 10 paid sick days that we've long fought for will finally be enforced tomorrow. And that means that for workers across the country at the federal level, they should not have to worry about going into work sick or having to work with a sick colleague or worried about losing a day's pay because they're sick. Those 10 paid sick days are now enforced at the federal level, and that's a big step forward for workers. And for dental care, I just want to encourage everyone to apply if you qualify for the program. That's $1,300 per child to get dental services that they need. This is very important to a lot of families. I'll be going into House today to talk about healthcare and what we need to do to protect our healthcare system. Across the country, we're hearing example after example, heartbreaking story after story about how serious things are, and that we need to see the federal government step up and take it seriously and protect our healthcare system, whether it's in Alberta with the threat of the Sovereignty Act with Danielle Smith and how she might use that to opt out of the Canada Health Act and make people pay to have to use a hospital, or in Quebec, where we're seeing some of the worst conditions for children in children's hospitals. We need to see an urgent response at the federal level to help out our healthcare system. Donc, premièrement, je suis tellement fier d'annoncer le fait que demain, les familles vont avoir accès aux soins dentaires pour les enfants de moins de 12 ans. Ça veut dire $1,300 pour chaque enfant. Et j'encourage les gens qui peuvent, qui sont admissibles, accéder à ce programme. C'est vraiment important et c'est quelque chose qui va changer la vie pour les enfants. Deuxièmement, demain, au niveau fédéral, le congé de maladie payé va commencer et c'est quelque chose qu'on s'est battu depuis longtemps pour réaliser et on est fiers que ça va être réalisé demain. Donc ça, c'est des bonnes nouvelles pour les travailleurs au niveau fédéral. Et finalement, aujourd'hui, je vais poser des questions sur la crise dans notre soin de santé, dans notre système de santé, et comment le gouvernement fédéral, le Premier ministre doit agir pour protéger notre système de santé. Quand je serai Premier ministre, je vais toujours prendre au sérieux notre soin de santé et comment on doit toujours le défendre. When I'm Prime Minister, I will always take healthcare importantly and always use resources at the federal level to protect it, to keep it public, to make sure people can get the care they need when they need it.
What do you think the federal government should be doing about the Alberta Sovereignty?
Well, there's a number of things that we think the government can start with, looking at a legal challenge, getting that ready right away in terms of how this is unconstitutional and the potential risk or threat that something like the Sovereignty Act could pose to things like the Canada Health Act. Let's see the government start taking steps to preemptively prepare a legal challenge. We just want to see some steps here, and we know that the federal government has powers. They should start using those.
Sorry, what are the political implications for NDP?
What's that?
What are the political implications of this act for NDP and specifically for not these chances in Alberta as well?
I think really the ramifications are for people, and that's what I'm deeply concerned about. In Alberta, the healthcare crisis that I talked about is probably one of the worst hit provinces for the healthcare crisis. And at a time when people are worried about getting care, you've got a premier that's so disconnected from reality that they're putting forward a bill that has nothing to do with the problems of the day. The cost of living, which is a major problem in Alberta. The crisis in our healthcare system. None of those things are going to be impacted by this. And in fact, it's going to make things worse if Danielle Smith uses the Sovereignty Act to opt out of federal laws like the Canada Health Act. That could seriously put in jeopardy the public healthcare system. So people might have to end up paying to use the hospital. That's what's at stake. And that's why the federal government and the Liberal government have to step up and do something to be able to protect healthcare and protect people.
Should the federal government use disallowance?
There are a number of tools. That is a tool that exists, and I think that the federal government should be presenting the options and should be moving forward with options. That's what we're calling for now, is some steps. Look at the options available. Disallowance is an option available. Look at things like a legal challenge preemptively, because we know this is clearly unconstitutional, and look at the impact that it's going to have on people who are already hurting with the healthcare system in crisis. So we want to see the federal government step in and do something. Oui. Oui, bien sûr. Donc, ce que Danielle Smith propose, effectivement, c'est quelque chose de complètement déconnecté avec la réalité des gens en Alberta. En Alberta, comme au reste du pays, on a une crise dans notre soin de santé. Et cet acte va faire rien pour aider les gens et a un potentiel de empirer la situation si Daniel Smith utilise ce projet de loi pour aller contre des lois canadiennes comme la loi canadienne sur la santé. Ça veut dire un potentiel qu'elle va forcer les gens de payer pour avoir accès aux hôpitaux. Donc ça, c'est quelque chose qui va empirer la situation en Alberta. Donc c'est horrible ce qu'elle a proposé et le fait qu'elle est complètement déconnectée avec la réalité des gens, ça montre une grande menace pour les gens en Alberta. Oui, donc j'ai dit, et je vais poser cette question dans la Chambre de communes, mais le Premier ministre a une responsabilité de répondre à cette menace. Donc, préparer une poursuite légale, proposer des solutions, comment il va défendre le système de santé public et comment il va défendre la loi canadienne sur la santé, quelque chose qui protège les gens. Donc, le gouvernement libéral fédéral a une responsabilité de montrer comment ils vont protéger les gens.
Statistique Canada me révélait encore ce matin que le français poursuit son recul au Québec comme langue de travail, que l'anglais poursuit sa progression comme langue de travail. En conséquence, est-ce qu'il ne faudrait pas... Quelle est la position du NPD sur cette idée que la Charte québécoise de langue française devrait être la seule qui s'appliquerait aux entreprises de compétences fédérales au Québec?
On a déjà appuyé cette idée de mettre en œuvre ce projet de loi au niveau fédéral aussi au Québec, donc c'est toujours notre position. Mais je veux parler un peu sur le déclin. C'est un problème, c'est une vraie menace et ça montre comment au niveau fédéral, on doit ajouter plus de ressources pour la francisation, pour promouvoir la langue française, pour avoir les ressources nécessaires pour avoir accès aux services dans la langue française et comment on doit vraiment prévenir cette recul ou cette déclin.
Donc, ces 13 doit-il être amendé pour prévoir qu'il n'y aura pas le choix entre la loi sur les langues officielles ou la charte de la langue française dans le cas des entreprises de compétences fédérales au Québec?
Notre position était toujours qu'on doit appliquer la loi au niveau fédéral au Québec et au Québec. Donc, c'était notre position.
If the federal government challenges the Alberta Sovereign Act or moves to disallow it, does that not risk strengthening Daniel Smith's hand, sort of getting her to say, look, we're standing up for Alberta against these feds who are coming in to challenge us? I mean, does that make sense to you?
Given how disconnected the decision of Daniel Smith is with what's going on in Alberta, particularly when we talk about healthcare, the whole province or the whole country is dealing with a serious crisis. We're hearing stories everywhere. We're hearing stories here in Ottawa as well. I went to one of the children's hospital and spoke with families there. They're telling us about these really horrible stories about kids waiting for hours and hours that couldn't breathe, real risk of children potentially dying in waiting rooms in hospitals across our country. Given how serious that is, and how this act does nothing to respond to the real crises that people are faced with in their immediate lives, cost of living, healthcare, I think it's appropriate for the federal government to step up and provide a plan for how they're going to defend healthcare, and not frame it around fighting the premier just for the sake of fighting the premier, but fighting for our healthcare system, fighting to protect healthcare, fighting to strengthen healthcare, to show that the federal government does play a role in making sure people can go in to get the care they need when they get sick. That is something that Canadians and Albertans can get behind, and that's something the federal government needs to do.
On healthcare, the federal government has offered large sums of money to increase the transfers. They've just asked for conditions. Do you think they're being unreasonable in the conditions, the strings they want to put on that funding?
No, I think it's appropriate that if we spend money, we should know where that money is going. I think Canadians understand that idea, that we should have an accounting and accountability, that if we invest in something, we want to see good outcomes. If we're going to invest money in healthcare, we want to see that people get better care, that there are less wait times. Those are appropriate things. Having conditions or having accounting is something that most people understand as reasonable. But what I don't think is reasonable is when we've got a healthcare crisis and in the first attempt to actually deal with it doesn't work, that the Prime Minister then says, okay, I have nothing else I can do. When there's a crisis, leadership is finding solutions. And when I'm Prime Minister, that's what I'll do. Anytime there's a crisis, I'm going to continually look for solutions to fix the problems. And right now, we've got a serious problem in our healthcare, and the Prime Minister isn't doing what's necessary to fix the problem, to help people, to make sure they get the care they need. Merci, thanks so much.